haven't done so already, please consider giving our show a like and a subscribe. And now, enjoy the episode.
Hello, and welcome to another episode of How I Got into PT School. I'm very fortunate today to be joined by CJ Miller. CJ, how are you doing today?
Excellent. Happy to be here. Appreciate you having me.
We're all very excited to have you on today, as you've had a very interesting past trying to get into PT school. I like your backyard setup you have going on there.
Yeah, that door behind me is actually a sauna.
Is it really?
So it's pretty sweet. You
Is it
build a little fire in there and dump some water, and you're good to go. It's a nice little treat for us.
there's there's a body of research around saunas being like cardiovascular. It's like the same.
Perfect.
Yeah, so you're doing you're doing a good job there.
It's great. Yeah.
So is that smoke in the air, or is that just like the ocean clouds?
It's hard to tell today. It's been really smoky. So I'd say it's probably a mixture of both. It's a little cooler today, so maybe there's some clouds in the sky. Um, but maybe 50-50 today. The smoke is getting much, much better. I'm down here in Santa Cruz, and so we've had ash and stuff covering everything, and so you're not seeing it fall from the sky, but it's still pretty hazy out. So
Yeah. Well, I hope for the best, and for you and your wife. Make sure you guys, stay healthy in those crazy times, in these crazy
yeah,
times. So let's start out getting to know a little bit more about your background. So CJ, where are you from?
I'm originally from Southern California, a smallish town called Laverne. I went to high school there. Basically grew up there through high school, and then ended up going to undergrad at a small Christian college in Santa Barbara called Westmont. I spent all 4 years there and lived there for, I think, 3 or 4 years after school, and took a little bit of time off before applying to PT school. And yeah, Westmont's where met my wife, and then we got married in 2017, and then we've moved a few places since then, but currently getting to hang out in Santa Cruz, which is awesome.
So me and CJ, we went to school together, and actually it was really fun. One of the first things or first conversations that me and you had when we were, you first meet your cohort, and you're like, oh man, there's so many people here. One of the first people I actually got introduced to was CJ, because he came up at the time I had just got engaged. So he was like, hey, you're married or getting married? So yeah, that was cool to see that someone else had already gone down that same path. You know.
Yeah, I specifically remember meeting you.
Yeah.
And I remember you said my name as though I'd met you before, and then I realized I was wearing a name tag, and I felt like a total idiot.
Yeah, I remember that. Um,
uh,
so CJ, did you play any sports or do any kind of extracurricular activities as you were growing up?
when I was really young, I played most sports, but I kind of latched onto basketball. I played basketball all the way up through high school, college, and then a little bit beyond that as well. So basketball, I've been pretty much a one sport athlete for most of my life. Yeah, I miss it. Not playing as much these days, but
Yeah,
I'd
probably
still
for the
like to
best
think I
seeing.
can get out there.
Yeah. It's probably for the best with how much smoke is in the air. Not going out to the courts.
Yeah, currently, definitely.
So were you first, so you have this very large experience with sports, in various things, it sounds like, when you were younger, but more so primarily just in basketball. Were you ever at any point introduced to physical therapy through your sports, or was it more so just something you knew about through other means?
Yeah, I'm kind of the classic PT case, I think, where I was playing sports. I hurt my shoulder my sophomore year of college. Had like a subluxation and saw PT, and that PT was awesome. He was also one of my professors, but he turned out to be someone I'm still in contact with today, down in Santa Barbara. But just had a really good experience. Didn't really know PT was a thing. I think I came into Westmont as a psychology major, switched shortly after to kinesiology, and then yeah, I was never really full force head down into knowing I was going to do PT. But I decided that if I could handle the prereqs, that it'd probably be good to try and get them out of the way. So I ended up going on the PT track, um, and it turned out to be a good decision. But yeah, introduced to PT through an injury, like a lot of people. And yeah, here we are.
Now you have a particularly interesting life trajectory, right? So you're being modest, I think, when you say you played basketball, because you played at a very high level, right? Is my understanding.
Yeah, I got to play a little bit after college in Hong Kong, of all places. I got to go over there and play professionally, and they paid me and covered my living and all my travel and stuff like that. And it was a blast. It was some of the best months ever,
So
just to be able to wake up and go explore the city all day and then practice at night, play a couple games a week, and it was it was awesome.
so now was basketball like primarily what you were trying to get into the pros, and then PT's kind of what you came to after that, or is my understanding right there?
Not really. Basketball for me has been kind of like a means to an end. Most of the time, I love playing, but I more enjoy the things that it brings you, like camaraderie with your teammates. And in this case, it was a chance to travel for free, um, meet a bunch of new people, have really cool experiences. Uh, to grind and try and make it to the highest possible level that I can has never really been the number one goal for me. Um, but more just to enjoy whatever experiences it allows me to have. It's been
Right.
kind of how I've most enjoyed it. It's given me a lot, so very grateful that I had the chance to play at all the levels and all the places that I did.
Yeah, and that's such a I think a good message, right? Is to kind of take what you're given and just be thankful for it. That's CJ was a great person to have in your class, and I truly hope that everyone finds their CJ in their life. It's someone who's very steady and keeps you calm and keeps you remembering why you should be grateful. So okay, so now you're going from high school, you're going into college, and you switch from psychology and now you're doing kinesiology. Did your college have any like pre-PT tracks or clubs or any sort of tools, I guess, that you utilized to help with your application?
Yes, they had a pre-PT track. That's what I was on. There was no clubs or anything like that, but that ensured I had taken all but maybe 2 or 3 classes at Westmont, and then the classes I didn't take at Westmont, I just took it at City College afterwards. There was just a couple like statistics I think I took, um, and maybe a bio class. I'm not even sure. I don't remember, but the majority of them I was able to get done at Westmont, which was really nice because it's always harder for me to go back to school when you're working or whatever else. So
Okay, so CJ,
cool.
so you've it sounds like you didn't have to retake any classes, which is great. So now we're moving into the territory of where your mindset was at when you were applying um, to your grad program. So do you recall what your application looked like in terms of your raw stats?
In terms of stats, I know my GPA was a 3.34. I believe that was cumulative. Westmont was a pretty tough academic school, so I kind of ran into part of the trouble I ran into was going to a school that was hard academically, but didn't have a lot of name recognition. So I think that was probably hurt me more than it helped me because I had the academic rigor, but not necessarily the name recognition that you would think.
Right, because
Um,
some schools are known to be harder. For example, Berkeley is kind of known to be a very tough
totally.
school. Do you think that schools in their application, when they're accepting applications, do you think they consider at all like where you went to school as part of like your GPA?
I don't know for sure. I would like to think they do. It
Right.
makes a lot of sense to me to think they do, especially if you're going to put weight in raw numbers. Um, but at the same time, yeah, I don't know. I know of a lot of instances where people's raw numbers look really good, and their academic rigor was just never there, but they still get into school and do well. I'm sure. So it's hard for me to make that call. Being in the situation I was in, I think I would hope that they would take that into account.
Right. Right. Okay. So it sounds like the raw GPA is maybe on like the lower side. How is your specific grade? The
Like the science specific one.
Yeah, the track, because I remember they have like an outline of certain classes that are like specific to PT school that they consider.
Yeah, I don't think I have an exact number. I think it was a little bit higher actually. Um, Part of the reason of that is I went to a small liberal arts school, and you are required to take a lot of general education classes, and at my particular school, those were often harder than some of your science classes.
Oh, interesting.
So yeah, they weren't grade boosters by any means. So my science one was probably not much higher, but I think it was probably a 3-4 or something.
Gotcha.
And then my GRE, I think, was a 154 and a 156. English being the first, 156 being the math section.
So pretty.
And then I got a 5, I believe, on the essay.
Yeah, the essays were tough. I recall.
Yeah.
If I would hate to say this and then not be correct, so take my words with a grain of salt. But if I recall, with the essays, it was more about the volume, right? Like they did an analysis of like the scores that people got, and it wasn't so much who wrote like the most articulate and concise, but it was actually better to write more in your
Interesting.
essays. Yeah, so I'll have to look that up. If I'm wrong, someone comment and correct me. But at least I vaguely recall something like that being the case. Okay, so
I just remember being so strapped for time on those essays, just like trying to throw in some conclusion sentence and a period and getting out of there.
Well, clearly it worked out for you, right? Because a 5, I think, is the best you can get, right? Or is it a?
I think a 6 might be. I got one lower than the best you can get. I remember.
Yeah, that's still really good. So I mean, it sounds like you're raw numbers, stats wise, you're pretty like average. You're in the middle of the road. Did you have any sort of extracurricular activities that you used on your application to kind of speak to you as an applicant?
I think I probably had pretty decent letters of recommendation, which I think is always really helpful to go from people you trust and who know you well. I had a short stint where I was volunteering with a PT clinic that provided services for the homeless population in Santa Barbara. I think that probably looked good on my resume, even though it was not a ton of hours. And then from there, yeah, I think my application, to be honest, was probably pretty average compared to what it could have been. And I think part of that is just, like I said, during school, I was never knew for certain I was going to try and go to PT school. I didn't even decide to take the PT track until after my sophomore year at Westmont. So basically, I took all of my gen eds and all that like junior and senior year. So I was in those classes with all the freshmen and all that, just trying to sneak them in before I graduated. So it was kind of an interesting track for me.
Yeah. So you kind of spilled into it a little bit, or you spoke to it a little bit, and that's where you got your hours for applying to PT school. Because certain schools, they have different hour requirements, and of course, some have different settings specific to where they want you to go. So it sounds like you had a really unique experience in that you got to work with the homeless population in Santa Barbara. Where else did you have to do your hours, or where did you get the opportunity, I should say, to do your hours?
Yeah, so that counted as my inpatient, because it was at a shelter where they stayed, and so that technically counted as an inpatient requirement. So I did not go into school with any actual hospital experience. So hospital, when I got there, was a little bit of a, I don't know, culture shock, if you will. But I did the majority of my hours at just a general private practice clinic as an aide. I worked there for probably between 2 and 3 years, and so I had
a substantial amount of hours.
I had more than I needed for hours there. And then they also had a clinic that was more of like a wellness recovery clinic. And so I had, technically, I think there was an option to mark a clinic as like a wellness setting. And so I did have a few hours in that setting as well. But the heavy bulk of my hours were just in general outpatient private practice.
So a topic that's come up in some of these interviews so far is whether or not it's better to have a very large amount of hours, or whether it's better to have more of a diversity. And so what would your take be, the diversity of settings or just the raw numbers being very high?
I think I'd go with diversity. I think that's really valuable. You know, after the first year of working at the private practice clinic, I'm not sure seeing the extra hundreds and hundreds of hours strengthened my application that much. I'm sure it did, but I think it probably didn't strengthen it as much as having 2 more settings that I was able to input on my application, if that makes sense.
Yeah, no, I
So
think
both
that's
are valuable, but I think you'll probably go farther if you have variety of experience than if you have just singular and a lot of it, would be my guess.
yeah. See, and that's a very good point, and it's a point that a couple people have made now so far in these interviews is that you know, bulk hours, or just having tons of hours in one place. I mean, that's great. It's good, especially if that's your job. But still, if you're trying to make your resume a stronger, or sorry, your application a stronger application, then you're going to want to try and get your fingers into a couple more pies, because physical therapy is a very diverse field. I actually didn't know about half the areas that we can work in before I started PT school. So there's so many different areas that you can physical therapy touches. Um,
Yeah.
okay, so we have your raw numbers. You're looking at applying to PT school. So how many schools did you actually end up applying to?
I applied to 13 schools.
Wow. And of the 13, how many did you get accepted at?
Oh man, not many. I got into, so let's see, I was waitlisted at maybe 3 of them. I got into one of them, and then I got in off of the waitlist for one of the 3 I was waitlisted at. So really only technically into 2 schools out of those 13.
Yeah.
And then I think I was probably on the wait list at 1 or 2 more, but took myself off once I was into Samuel Merritt, where I ended up going.
Right. Were you waitlisted at Samuel Merritt, or was that the one that you got just straight into?
I was waitlisted at Samuel Merritt.
Waitlist buddies, let's do it.
Yes. Yeah, so I was getting pretty nervous, seeing a lot of no's come in, and then when I finally, Samuel Merritt was pretty high on my list, so I was kind of waiting for them. They were probably the one I was most interested in, or at least in my top 2.
Mm-hmm.
And I was 30 on the wait list, and 30 seemed awfully high, so I was still pretty nervous, and by no means a shoe-in.
Right.
And then I ended up getting in probably a month or so after I heard, so
That's good.
very grateful for that.
So don't get discouraged. If you're a waitlister, you know, you have 2 faces here that made it into grad school from the waitlist, so.
Yes.
So
Yes.
how did you figure out, so of the so you applied to 13 different programs. Was there a way that you navigated through all the different programs? Did you select them based off of certain criteria, or like how did you figure out the 13 schools that you wanted to apply to?
I'm kind of a, and I don't know, I didn't put a whole lot of thought into it, if I'm being completely transparent. If it was in California, if it was close to the ocean, or if it was in a place that I wanted to live and hang out for 3 years, I probably applied there. So I think it was like 10 California schools and Colorado, Oregon, and Washington, or something like that. Just basically places that I would want to live. And being married, I think maybe I was able to take that into account a little bit more. You're not just
Planning for yourself.
moving somewhere for yourself, but you know, where does my wife want to hang out and live and get a job? So Samuel Merritt was really close to family for her, and so that was a really big push on why I really wanted to go there. But the majority of my places I applied were a lot to do with living situation, and then obviously I looked, and if I didn't meet the prereqs at a place, I didn't apply or anything like that. So I did my due diligence in terms of filtering out places that I felt like I had a shot at getting into.
Right. So you went through PT CAS, and you actually made sure that your application was worth putting an application into places based off the prerequisite requirements. I remember actually when I was at Samuel Merritt and I was doing, so Samuel Merritt they don't do interviews, but they do info sessions where everyone who applies is allowed to come, and you very much should do that if a school is offering an info session, just take full advantage of it. And I remember talking to this woman who had applied to like 50 different schools, and I was like, did you check? You can get into 50 different schools, because the prereqs for that is, in my mind at the time, I was like, that's crazy. And she's like, no, I didn't check at all. Just as many as I could. And all I could think was like, that was thousands of dollars you just spent for no reason.
Yeah, I remember there was one school I tried to I tested them a little bit, I guess. It had like $100 application fee. So in hindsight, this was so dumb. But I didn't take calculus in college. I didn't have it. So calculus was one that some places require, some places don't. And this place required it. And I was like, are they really gonna shoot me down just because I don't have calculus of all things. And it was like instantly, sorry, you don't have calculus. And I got a no in like a week. And I was like, well, there's $100 I just tossed down the drain. So yes, do your work. They mean it when they say they require classes.
Yeah, don't mess around with it.
Yeah.
And there's
Doesn't work.
another aspect to your application that you kind of, I think you read in between the lines of what you're saying to get that, but I want to highlight it because I think it's so important, and that's you're kind of touching on this work-life balance, right, between being a student and between having a life. And I think you, more so than most people I've met, kind of really embody that idea in that just in like what you were saying, right? Like I wanted, where am I going to live for 3 years, right? Most students, you might be doing your application thinking like, I'm just going to go to wherever accepts me, right? Like that might be your mindset, and that's fine. There's nothing wrong with that, but also take into consideration what's going to make you happy, right? Because you're going to spend the next 3 years of your life dedicated to this school, that location. So take the extra time, do the research, make sure you're going to be happy there. CJ wanted to be able to, hopefully go to the ocean, go somewhere that had like a lovely area, and obviously somewhere that worked for his wife. And so that's his criteria. And I think a lot of the time that message probably gets convoluted amongst all the other things that you're thinking about when you're trying to apply to PT school. So and to give everyone another thing to think about, try to keep that in the back of your mind. So you kind of talked about where you wanted to apply and why. Is there anything that you would have done differently? So now, given that you've gone through this whole process of applying, getting in, interviewing, is there anything that you wish that you could have done differently for your application?
I think having more variety in my extracurricular activities probably would have helped. I didn't have many PT specific extracurricular activities or anything like that. I kind of met the minimums aside from the outpatient requirement. I kind of met the minimums of what you need per setting. I didn't have a whole lot else that I had been working towards that set me apart from a PT standpoint. I was a pretty good athlete, and I, volunteered with churches and played music and for a lot of different things, but none of that was very PT specific. So I'm not sure. That probably would have helped a little bit more, was to have a variety of more PT specific things. But like I've kind of already said, I was never kind of head down full force PT. So I had to kind of play the hand I was dealt. I got no's from a lot of places, but I got into the one I wanted. So yeah.
and clearly in the long run, it worked out. So there's, nothing wrong with how you approached it, for sure.
Totally. And one thing I'll say is easy to get discouraged in the application process. I was getting no's from a lot of places. I remember my mom being like mind blown, classic mom move. Be like, what do you mean my son's not getting into PT school? Like at all these places, like, well, can you call him? Can you ask him why? I'm like, no, just anyway. But it definitely, the difficulty I had getting in, I consider it difficulty, even though I know for a lot of people it takes multiple years. I was lucky I at least got in on the first go. I just happened to go, 2 for 13 or whatever it was that I applied to. But it's not indicative of how well you're going to do in PT school. If I'm being totally honest, for me, getting into PT school was harder than PT school. I loved school. I enjoyed it. You get to hang out with your classmates. Everyone's grinding through the same thing. My statistics in PT school are much better than my statistics in undergrad, like by far. I think I finished undergrad, like I said, with a 3.3 something, and I finished PT school with a 3.7 something. So, yeah, it's not, your difficulty getting in is not indicative of how successful you're going to be as a student, because if that was the case, I would have had a much harder time than I did.
Yeah, I think that's a really good message too. Getting in is sometimes just the hardest part, and I know in a previous interview I was telling someone, like, the joke is again just that, like, getting into PT school is harder than PT school itself. I still felt like PT school was pretty hard. There was times where I was really stressed, but someone is like, from a CJ has like this really steady personality, which makes like PT school. It was a fantastic experience. I will say the quality of people that you surround yourself with is unlike any other situation you're gonna have in your life. So you're gonna be surrounded with just like the most fantastic people that you're probably ever gonna meet, and that makes the whole process just so much smoother.
Perfect.
Yeah. Okay. So CJ, where are you now, and what's happening in the life of CJ?
My wife and I are in Santa Cruz. We moved here about 3-ish weeks ago, and we moved here because I took a job at the VA clinic I had been working for, just at a different location. So Santa Cruz is halfway between Monterey, where she goes to school, and Palo Alto, where I'll be commuting for this job. So the job is an outpatient orthopedic physician, but it's going to have a lot of really cool learning opportunities just with more complex patients, and it's at an actual hospital. So I'll get to float through acute care, acute rehab, spinal cord injury unit, along with being primarily an outpatient. So
That's fantastic.
I'm excited. It's going to be nice and challenging. In the VA, you get to see people direct access, which I know is pretty common now in PT land, but in the VA, they've done a good job, at least in this system, of setting up acute care clinics and stuff like that, and they place PTs in the emergency room as well. So it's really, you get to use kind of your full PT school brain, which I think is a really good thing as a new grad.
Yeah, that sounds fantastic. I didn't realize that they had. I know that the VA, which is the Veterans Affair, right? Or is it? Was it?
Yeah,
Yeah. So the VA. So you're working with veterans. The VA they offer a lot of things that other PTs can't do. For example, you got dry needling certified, which is not
yeah.
allowed in California except for those who are working in the VA. But I wasn't aware that you could work in like a hospital type emergency room setting. That's really interesting.
Yeah, they've been placing PTs in there to, I guess, so a lot of what the ER sees is musculoskeletal, but what they get sent home with is probably often kind of a lack of education and pharmaceuticals of some sort. So you're at your back, here's some, some sort of pain reliever, and they send you on your way. A lot of times you don't even get the referral to PT. So now we've placed PTs in the ER to take some of that stress off of the staff that's there, take some of their musculoskeletal cases, and then on that same day, we can make them feel better through dry needling, or just honestly, a lot of times just through education, manipulation, stuff like that. And then we can set them an appointment to follow up with them. So their eval has been done in the ER, and then they can get into a nice PT track in the outpatient clinic. So it's a really, that particular function of this VA system is relatively new within the last year or so, but I think there's a lot of potential to do a lot of good and to get people the care they need, rather than just going to the ER and being done, and then who knows, in a month or so they hurt their back again, and the cycle continues. So now we can get them to the people they need to be seen by quickly, which is really nice.
And that's fantastic. I think that's such an opportunity within the current healthcare system, is to try to alleviate some of the burden, right? Figure out where there are holes, where time and energy is being wasted, and try to fill that with someone, in our case, PTs, that can help alleviate some of that stress on the medical system. That's fantastic. I didn't realize they did that. So we're kind of speaking, so you are in this very unique position, I think, in the VA, where you get to have insight into a situation that's very different than like the standard, as compared to like the normal flow of events outside of the VA, in terms of like hospitals and whatnot. So where do you see change happening in physical therapy within the next 10 years?
Yeah, I guess I can tell you where I'd like to see it go, whether or not it goes in this direction. But I think direct access was a huge win. I think there's a pretty big misconception about the degree that PTs have. It's a medical degree, and there's a lot of medical knowledge that came with it. And the small lens view of PT is that it's just an outpatient clinic. and you rehab people from surgeries, I guess would be probably a lot of people's view of PT. So my hope would be in the next 10 years that the profession, we advocate that the profession is a medical degree, that there is a broader scope and a bigger purpose that we can serve. I think the VA, and I can only really speak for the system I'm in Palo Alto, but they're doing a really nice job of setting goals to educate others on when PT is appropriate, and start getting referrals that might not otherwise be given, and then placing people where we can help be the first practitioner they see. So similar to a primary care role. So you can go up to work with the PAs and the doctors and give your opinion on all things musculoskeletal related. I think PTs are respected, but it doesn't really feel like we always have a seat at the medical table, if you will. We're not in those conversations in like a horizontal manner where you're in the decision-making process from patients early on. And I think that would be a really nice thing to advocate for in the profession.
Yeah, I think that's such a, what you're talking about is such a powerful message, right? And to kind of further your point, and in speaking that, we do have these medical degrees, and there's you could bring up examples all day, but the first one that comes to mind is a friend of mine he's going for psychiatry now, sent me, or we spoke about recently, the effect that exercise has on depression, right? And so there's in severely depressed patients, by doing moderate amounts of exercise, you can get up to a 55% decrease in depression symptoms, and that message is so profound, right? So they didn't take any, they didn't have to take drugs. There wasn't any sort of medications that were altered. Just simply our role and our knowledge of how to safely exercise someone, especially in a medical condition or with a medical condition. You could see such a profound effect, And so, that's just one example that comes to mind. But there are so many instances like that where I think PT could certainly stand to, again, fill the slot where the medical system is lacking for that patient. And then hopefully, I agree, I would imagine that by doing so that it would give us more precedence for a seat at the table when it comes to the medical community.
Yeah. A lot of that is just education and kind of building the bridges between doctors and all healthcare professionals that we work with and PTs, and I think there's a pretty big knowledge gap in terms of what we actually know. And so just building those bridges and those networks of communication to where the people who would benefit from PT get it. They get placed in the right settings in order to really get better.
Yeah, it's such a good message. I think that's going to be I would love to dig into that more, because I feel like there's a lot to actually talk about within that one. So maybe we might do maybe a discussion sometime down the road. We can really suss that out and figure out more details, because that'd be a great conversation, I'm sure, for anyone to hear.
The sequel.
Yeah, the sequel. So in summary, right? So we have all this information that you've given us, this is fantastic. Thank you a lot for being on here, because there's a lot that I think people can take away from this interview. Is there anything specifically that you'd like to give in terms of someone starting their journey, whether they're in the application season right now or they're thinking about PT, that you feel like would be good for them to know?
I think I touched on it a little bit earlier, but if you're talking really about getting into PT school and starting the journey, I think a lot of it for me would be not to get discouraged, not to put your identity in your numbers, because I think I'm a decent example of someone who was not top of my class numbers wise, but did very well and was very successful in PT school. I enjoyed it. I was able to keep hobbies going into PT school throughout PT school while maintaining classwork. I actually got a perfect 800 on my boards a few months ago. So
wait, you got a perfect 800?
I got a perfect 800.
What?
So
that's wild. Congratulations.
My 2 for 13 on going into PT school is like not the end of the road. It does not mean you're going to struggle through it. Yeah, keep your priorities where you need them to be. If it's maintaining your hobbies or relationships and stuff like that, like you are allowed to prioritize those things, and you'll enjoy it a lot more. So
Yeah, such a good message for people to hear, because I know, like, when I was taking the app, or when I was doing the applications, I was consumed, right, by the application, constantly checking to see where I was at on a wait list, or if I had new emails about. So there's a lot to worry about, and I think it's really good for potential students to, or potential PT students to be hearing that message, right? Like, it's okay to be happy too, So focus on yourself. All right, CJ.
Totally.
Well, I'm very happy that we got the chance to sit down and talk. It's been great. Thank you so much for your time.
Yeah.
And with that, I will talk to you later.
All right. Sounds good. Thanks a lot.